Hi everyone, in this video I'm going to explain about chapter 15 coding guidelines, pregnancy, childbirth and the puerperium, and the code series is O00-O9A class 1. So when we receive a medical report in which the patient is pregnant, so we need to follow some coding guidelines to code a particular medical report. So what are those coding guidelines to follow for the pregnancy medical report? Now we will see in this video. General rules for obstetric cases, codes from chapter 15 and sequencing priority. So when we receive a medical report in which the patient is pregnant, so directly we should not code the ICDs where the diagnosis is given by the physician. Suppose he is giving the diagnosis as dehydration, so directly we should not code the dehydration. So in the place of dehydration, first we have to code the O series, that is, see here we have the ICD series O00-O9A, pregnancy, childbirth and the puerperium. So first principal diagnosis we have to code the O series, and then secondary we have to code the additional codes from other chapters, like whatever the diagnosis is there we have to code that. So whenever we receive the medical report of a patient who is pregnant, so first we have to code the principal diagnosis as O series. From in between of these ICDs, that is O00-O9A, we have to give the O series, and in between of these series we have n number of diseases and conditions related to the diseases and conditions from other chapters. So first we have to code these ICD, and then later the secondary diagnosis should be from other chapters. So to have an idea, we will see in the software. See what is the normal. Suppose a patient is coming to the hospital and physician confirmed as dehydration. So normally for a normal patient, how we will code? We will type the dehydration and the ICD is E86.0, right? So for a patient who is pregnant, we have to code the O series, as I told, right? First principal diagnosis we have to code this. So first we have to code the O series. So this is related to the metabolic nutritional disease, right? So we have to see the ICD of O series in this classification, that is in the O series classification. We have to find out which for which it is related, and we have to code the particular ICD. See, endocrine, nutritional and metabolic disease, complicating pregnancy, like that. Based upon the trimester we have the classification. What is the trimester? I will explain you later. So like that, first we have to code the ICDs of the O series, and then later we have to code the dehydration. So first we have to give the O series related to particular disease, and then the other chapter ICD. So like that we have to code for the pregnant patient. So we will see the remaining coding guidelines. Should the provider document that the pregnancy is incidental to the encounter, then code Z33.1 pregnancy state incidental. Suppose a patient who is having a UTI problem has come to the hospital. So physician, what he will do? He will do some lab test, right? Like lab analysis, like pregnancy test, and remaining any other lab test will be there, urine culture or whatever. He will do all the lab tests, right? And in that, if the patient has found that she is pregnant, by doing the pregnancy test, the physician is confirming that the patient is pregnant. So in those case we have to give Z33.1, that is, patient also doesn't know that she is pregnant. She is incidentally, unknowingly, she got to know that she is pregnant by doing the lab test by the physician. So physician will be ordering the lab test. So unknowingly, after the lab results has come to the physician, and by the physician he will be giving the diagnosis, right? So in that, if he is stating that the patient is pregnant incidentally, unknowingly, so in those case we have to code Z33.1. So whenever in the medical report physician is documenting that she is pregnant incidentally, unknowingly, so in those cases we have to code Z33.1 ICD. chapter 15 codes used only on the maternal record. So normally we'll be getting the newborn records and any other records, right? So these chapter 15 codes we have to code only for the mother record only, that is maternal, only for the obstetric records only we have to code. Final character for trimester. So as I told, right, trimester here, see in this we have the trimester, see here we have the trimester, see first trimester, second trimester, third trimester, unspecified trimester. So for each ICD of the pregnancy, here we have the seventh character. Here last one is there, right, unspecified. Like this we have the trimester for each code. So what is this trimester? So what does it indicate? So trimester is very important. So it is not a complete component of the code because some conditions will occur in a specific trimester. So what is trimester? Trimester is nothing but it gives the time period of the pregnant, that in which week she is. See, for first trimester she will be in between of 1 to 14 weeks, like that. For second trimester she will be in 15 to 21 days, like that. So we have the trimester like that. So for each ICD of pregnancy we have the trimester. So because some complication will occur in some trimesters like hypertension, diabetes, as the age of the pregnant, that is the gestational age, will be increasing, so she will be getting some complications, right? So it is not a complete component, but because some conditions will occur in some trimester, so for each final character, that is the seventh character, it gives the trimester of the pregnancy. So based upon the trimester we have to code the ICD for the pregnant. Selection of trimester for inpatient admission that encompass more than one trimester. So suppose a patient is getting admitting to the hospital and she is in first trimester and she is getting a complication like hypertension, that is her BP has been elevated. So in the first trimester only she got the BP elevated, so she got admitted and she is getting the treatment, and after 2 to 3 days she has entered into the second trimester. So after the treatment she is getting discharged in the second trimester. So how we will code this scenario? So we have to code the hypertension complicating pregnancy first trimester we have to code, because at the time of the discharge she is in second trimester, so we should not code the hypertension complicating pregnancy second trimester. We should not code the discharge time trimester. We have to code the admission time complication. So at the admission in which trimester she is, we have to code that complication. She see here you can see, when a patient is admitting to hospital for complication of pregnancy during one trimester and remains in the hospital, and subsequently she entered into the second subsequent trimester, like from first to second trimester she has entered, and the trimester character for complication code should be assigned based on the trimester when the complication has developed, but not on the discharge trimester. So whenever a patient is having some complication, so at the time of which trimester she is getting admitted, we have to code that, like hypertension in the first trimester she is having, so we have to code that only, but not during the discharge time. So during the discharge time she is in the second trimester, suppose she is in the second trimester, so we should not code the second trimester. So at the time of the admission which trimester she is, we have to code that complication along with the trimester. So similar way, whenever a patient is having a pre-existing conditions like hypertension or diabetes, anything is there before the pregnant only she is having the complications, so same thing at the time of the admission, which she is the trimester which she is having at the time of the admission, so we have to code that only, not the discharge trimester. So whenever a patient is having any complication at the time of the admission in which trimester she is, we have to code that only, not the discharge trimester. Suppose if she is in one trimester and she's remaining in the hospital, and later days she has entered into the subsequent trimester, we have to not code the subsequent trimester, we have to code the first trimester, that is the one the trimester which she is having at the time of the admission, we have to code that only. Unspecified trimester. What is unspecified trimester? So sometimes what happens is, in the medical report the physician will not document in which trimester she is, that is she is in how many weeks, like whether she is in 25 weeks, 35 weeks, 21 weeks, like that the physician will not document. Or suppose there is no insufficient data for the trimester to determine in which trimester she is, or else it is not possible to obtain the clarification, he is not confirming properly. So in those cases the trimester is nothing but the time period, that is in which week she is the pregnant, in which week she is, that is from first to 35 weeks, in between of that in which week she is, we don't know, the medical report is not documenting or supporting. So in those cases we have to code the unspecified trimester for each ICD of the pregnancy ICD, we have the unspecified trimester. See, you can see here first trimester, second trimester, if clearly 14 weeks like that is there, so based upon the weeks we have to code the first trimester, second trimester, third trimester based upon the weeks. Based upon that calculation we have to code the trimesters. If nothing is documented, so we have to code the unspecified trimester as per the guideline. We will see the remaining coding guidelines. Seventh character for fetus identification. So whenever applicable in ICDs of pregnancy, we have few codes where you can identify the fetus in the seventh character ICD. So here you can see these are some of the codes, it identifies the fetus. So in order to understand, we will see the ICD. See here O60.01, O60.1. So in these ICDs I am taking O60.1. So O60.1, see here they have the seventh character 0, 1, 2, 3. So what it identifies is, it identifies which fetus it is, like fetus 1, whether it is fetus 2, whether it is fetus 3, or whether it is fetus 4, like that it identifies the fetus. So we have to give the seventh character 0 for single gestation, or we don't know for which fetus the complication is occurred, or if it is not possible to clarify. So or it is clinically not determined which fetus it is affected. So here you can see seventh character 0C. So as per the guideline, we don't know for which fetus it is affected, the complication, or clinically unable to determine for which fetus it has affected. So in those cases we have to give the seventh character 0 in the document. If it is not clear which fetus, so we have to code the seventh character 0. If it is fetus 1, 1. So like that for each seventh character we have the ICDs to identify the fetus. If nothing is clinically not determined, so we have to assign seventh character 0C, not applicable or unspecified, it is clearly given. So like that we have to code the ICDs. So I will give you the first trimester, second trimester, third trimester weeks clearly in the next video. You can see in that video, that is to which in which week for particular week she belongs to which trimester. So like that you can identify. So I will explain this in the next video. So these are few coding guidelines of pregnancy. I will continue the remaining classes in the next video. Thank you. If you have any queries, please comment below. Thank you.